This is the evaluation criteria of the 9 images that I took for my barium enema of my contrast study for the large colon. The first is a KUB, which shows the state that the colon is in. We need to have proper collimation. We need to be able to see the area from the pubic symphysis to the upper abdomen. 2 images might be necessary if it's a larger person. We need proper patient alignment, and that is shown by a centered vertebral column. Ribs, pelvis, and hips are equidistant to the edge of the image. There's no rotation of the patient, and that's demonstrated by the spinous processes in the center of the lumbar vertebra. The ischial spines of the pelvis are symmetric. The ala or wings of the ilia are symmetric. We have soft tissue brightness and contrast, and that shows by the lateral abdominal wall and the peritoneal fat layer. We need to see the psoas muscles, the lower border of the liver and kidneys, the inferior ribs, the transverse processes of the lumbar vertebrae, and the correct marker on the right side and not overlapping the abdominal contents. The projections from here on are showing the images with the contrast in the colon. The first is a PA projection, and you should have proper collimation. The entire colon, including the flexures and the rectum, should be shown. 2 IRs might be necessary if it's a hyperstenic patient. The vertebral column is centered so that the ascending and descending portions of the colon are included, and of course proper technique that shows the anatomy. My third projection was the PA axial projection. We should have evidence of proper collimation. The rectosigmoid area centered to the image using a 10 by 12. The rectosigmoid area with less superimposition than the PA projection because of the angulation of the central ray. The transverse colon and both flexures may not be included. We also should have a good exposure technique that shows the anatomy. The fourth projection is the PA oblique projection REO position, showing evidence of proper collimation, the entire colon, the right colic flexures less superimposed or open compared to the PA projection, ascending colon, cecum, and sigmoid colon, as well as exposure techniques that show, or technique that shows the anatomy. The fifth projection is a PA oblique projection LAO position. We should have evidence of proper collimation. We should be able to see the entire colon. The left colic flexure is less superimposed or open compared to the PA projection. We should see the descending colon and exposure techniques that show, or technique that shows the anatomy. Okay, my sixth position was the lateral projection, my left lateral position. There's proper collimation, the rectosigmoid area in the center of the image. There's no rotation of the patient. We have superimposed hips and femora. The superior portion of the colon is not included when the rectosigmoid region is the area of interest. And of course, we have proper exposure technique that shows the anatomy. My seventh image is the PA projection left lateral decubitus position. We should have evidence of proper collimation. The area from the left colic flexure to the rectum is shown. There's no rotation of the patient, and it's demonstrated by the symmetry of the ribs and the pelvis. For single contrast examinations, there should be adequate penetration of the barium. For double contrast examinations, the air-inflated portion of the colon is of primary importance and should not be overpenetrated. And of course, good exposure technique to show the anatomy. My eighth image is the AP projection right lateral decubitus position. We should have evidence of proper collimation. The area from the left colic flexure to the rectum, no rotation of the patient, and it's demonstrated by the symmetry of the ribs and the pelvis. For single contrast examinations, adequate penetration of the barium. For double contrast examinations, the air-inflated portion of the colon is of primary importance and should be not over-penetrated, and also good exposure techniques to show the anatomy. And my ninth and final image is the post-evacuation PA KUB. So we're going to see some residual contrast in the colon, but you should still have proper collimation. The entire colon, including the flexures and rectum, are visible. Again, you might need 2 IRs to show the areas with the hypersthenic patients. The vertebral column centered, so the ascending and descending portions of the colon are included, and good exposure technique that shows the anatomy.